you're on active surveillance, it tends to suggest that your disease is low risk or maybe low level intermediate risk. And therefore, it's not something that's an imminent problem for you, but something that may prove to be a problem later on in life. And the monitoring, would largely pick that up. For some people, that whole concept, is uncomfortable for them, and they feel that they've got a sort of ticking time bomb inside them. And it's really my job, first of all, to try and reassure you about that and try and explain what steps we'll take to monitor that situation so that early intervention can be taken if adverse signs develop. But for some people, that's just not good enough, and focal therapy can be utilised in those circumstances, particularly if we've got a target to look at, a lesion that is concerning potentially. Those cases of active surveillance can go ahead and have a very low risk treatment and sort of get rid of that lingering concern, that lingering risk that it might progress unexpectedly and lead to a more worrying situation. But I think we'd like to try and avoid men with really trivial levels of disease having unnecessary treatment. And so part of my job is to try and reassure you, if that's what you've got, that actually you really don't need treatment right now. And perhaps the best thing to do is to just have really good monitoring and have it done with the best quality scans, so that if in the future it does evolve, we can actually evaluate you properly and have a focal therapy treatment, maybe 2 or 3, 4, 5 years down the line, if necessary. And I think, providing that reassurance is another important role of the second opinions that you get at the focal therapy clinic.